covering is the pericardial sac that helps to anchor the heart in the chest, in the cavity, all right? Then deep to that is going to be this layer right here. This is the epicardium, all right? And I can just pull it up. It's thin. It's simple squamous tissue with a little bit of connective tissue with it, but it's about the thickness of a sheet of paper. So epi means upon, all right? So this is my outer layer, and the epicardium of the heart is one and the same as the visceral pericardium, all right? So this visceral pericardial layer and then the fibrous layer over the top, there's fluid between the two. That fluid helps to prevent friction when the heart beats. All right, so again, layers, this is epicardium or visceral pericardium. All right, if I flip to this side, all of this is going to be myocardium, which is the muscle layer. All right. And then deep inside, all right, will be the endocardium, which is the shiny layer. Let me see if I can find a good, oh, this guy looks the best. All right, so in this heart, you can see in the ventricle, see the shiny layer in there? You guys see the shiny layer? All right, that's my endocardium. That shiny layer, again, is simple squamous with a little bit of connective tissue. It's, again, about the thickness of a sheet of paper, and its job is to make a nice shiny surface, smooth surface, so you don't have blood clots forming. All right, so it's continuous with the endothelial lining of the blood vessels. All right, so it gives you a nice slick, slippery surface, so you don't have to worry about blood clots forming from those layers. Chamber-wise, all right, we've already talked about this somewhat. All right, this is going to be my right ventricle. This is my left ventricle, and the way you tell is the thickness of this wall. Right is thinner than the left. In between them is the interventricular septum. All right, this is the wall. Inter is between, ventricles between the chambers, septum is wall. Okay, we learned that with the heart. All right, so these are the two lower chambers. Then up higher, we're going to have the atrium. All right, and we have, once again, we're going to have the right atrium on the right side and the left atrium on the left side. Okay, the flaps on the outside are the auricles. All right, so this is an auricle and this is an auricle. Their job is to increase surface area when you've got a lot of blood venous return, so especially during exercise. So the auricles are the flaps on the outside. The atrium are the chambers on the inside. You will see that the chambers are lined with the muscles. Okay, these are pectinate muscles. You find them in the auricles, in the atrium. They look like your pectinate muscles of the chest. So that's where they get their name from, because the fibers are really interwoven, kind of fan out. All right, so that takes care of that. In the ventricles, we have the papillary muscles. All right, so this is a papillary muscle, this is a papillary muscle. This is a papillary muscle here, this is a papillary there. Papillary means nipple-shaped, so this one in particular definitely looks nipple-shaped. And then what you will see coming out of the papillary muscles are the chordae tendineae, all right, the cords of tendon. These fiber looks like strings coming out of it, and they are going to be attached to the cusps or the flaps of the valves. All right, so these valves between the atrium and the ventricles are the AV valves. On this side, on the right side, we're going to have the right AV valve, okay, also known as the tricuspid valve. All right, so it has two names. On this left side, the same valve, and I'll pull up these cusps because you can see them a little bit. All right, see the cusp there? These are the flaps. So this flap between the atrium and the ventricle, this would be the left AV valve, also known as the bicuspid valve because there's two flaps that make up the valve, and or the third name is the mitral valve. Okay, so those are the two sets of valves between the atrium and the ventricles. In addition to that, we have the semilunar valves. All right, and this is the pulmonary trunk on the front side of the heart, on the anterior side of the heart. It's the first blood vessel. If we open it up and look inside, you're going to see the semilunar. These are the pulmonary semilunar valves located in there, inside. And then directly behind it is my aorta. And we will see, and I can show you, this one's easier to see. See, this is the cusp, one of the cusps of the aortic semilunar valve right there. There are 3 cusps in each of them. All right, so the cusp is the flap. All right, so both the pulmonary semilunar and aortic semilunar, this is what the cusp looks like, and there's 3 flaps or 3 cusps within each of those vessels. You can tell that this is the pulmonary trunk because the lumen is open, same as the aorta. All right, that's how you know that these are arteries. They're going to carry blood away from the heart. Because I want to show you here. All right. All right, so this is, again, see that the lumen is open. All right, so this is my pulmonary trunk right here. If I pull this back, you can kind of see a little bit better. See the semilunar valves in there? And again, when you get your hearts again next week, look for these yourself, okay, so you can see. So this is my pulmonary trunk. This is my aorta directly behind it. All right, it's open. This branch coming off is going to be my brachiocephalic artery coming off. And if I look at this one, nice to have lots of hearts, okay? So this is my aorta right here. All right, this is my ascending portion of the aorta right here. All right, and then it's going to branch. This is the aortic arch. Okay, I know it's the arch because this vessel, brachiocephalic, is the first vessel that comes off the arch. Okay. In addition to that, I've got coronary blood vessels, coronary arteries. All right, they're located, the openings are located right here above the aortic semilunar valves. These are the arteries that feed the heart itself. All right, so these are the very first 2 vessels that come off, the coronary arteries. The first vessel that comes off the aortic arch is that brachiocephalic. So don't get confused by that, okay? So these coronary arteries are going to feed the heart. It's going to give blood to all of the heart. So we'll look at the blood vessels associated with it. All right, so this is an anterior section of the heart. All right, here's my pulmonary trunk. Here's my left auricle right here. All right, and then running down through the middle of this anterior section is an anterior interventricular sulcus. Okay, so anterior because it's on the front, interventricular because it's between the 2 ventricles. It follows right along with the septum. All right, sulcus because it's a groove. In that groove sits your anterior interventricular artery and anterior interventricular vein. All right, so I have this on the anterior side. Then what must happen? I have the same thing on the posterior side, okay? An posterior interventricular sulcus with a posterior interventricular artery and vein, okay, in the groove. All right. In addition to that, around the base of the heart, this is the base of the heart. Around this big fat edge is the base. All right, and around the base there is a coronary sulcus, okay, a groove. And in that coronary sulcus is your great cardiac vein. All right, and then on this posterior side, that great cardiac vein joins together and with the posterior interventricular vein, and all the blood drains from the heart into this coronary sinus. Sinus is a cavity that accepts a lot of, in this case, a lot of blood. Okay, so blood vessels as far as by chamber going into my right atrium is that coronary sinus, and superior and inferior vena cavas. All right, so if I take my finger, now we showed you that the arteries, the lumen always stays open. In the veins, it does not. So if I do this, where my finger's coming up through, see how thin-walled that is? That's my superior vena cava right there. All right, does everybody see that? So as soon as I take my finger out, it collapses down. all right, because veins are compliance vessels. They're very thin wall. They collapse right down. So in order to see a vena cava, you have to push up something up through it to open it up. Okay, so this is so superior vena cava, inferior vena cava, and then coronary sinus all empty into the right atrium. All right, then the next one is the pulmonary arteries. Get my finger out. All right, pulmonary arteries branch off of the pulmonary trunk. So this is my pulmonary trunk right here. It will come up and it will branch to either side, to the right and left side. Those are going to be my pulmonary arteries. Arteries carry blood away from the heart. Arteries keep their lumen open. Okay. In addition to that, then we have pulmonary veins. Pulmonary veins are going to bring blood back to the left atrium. All right, and I think there was one that was still viable on this guy. All right, so again, because these are veins, they always collapse down. All right, so there's one right there. There's 4 pulmonary veins. Okay, they bring it from the right side and the left side of the lungs, and they dump them into this left atrium. So all these openings that I'm showing you are where the veins come back and dump the blood into that left atrium. All right, so that's the vessels associated with left atrium. With the left ventricle, all right, we have the aortic. All right, the aorta. So aortic semilunar valves right here. This is my ascending aorta coming up, first part out. All right, aortic arch is where it curves, and the arch begins where this brachiocephalic artery branches off. All right, and then it stays the aortic arch until it downturns, and then it's going to be the descending aorta, which will then become the thoracic portion, which will then go through the diaphragm and become the abdominal portion. All right, so I think we got, and we already talked. Okay, on the hearts, you can see this brachiocephalic artery. That's usually in place. But that left common carotid and left subclavian, we don't have any that have that. They're always cut off, okay, when they take the hearts out of the chest. All right, we always lose that. All right, so that takes care of all that. Got that. Chordae tendineae, papillaries, trabeculae, pectinates. Oh, interatrial septum. We said this is the interventricular septum here. The interatrial septum is up here, but because it's behind the great wall, the vessels, you're not going to see it. Okay, on these models, you just have to know that it's there. All right, because we're going to talk about it when we talk about the fossa ovale.
Can you show where the dog flap is?
Yeah. So on this heart, this would be one. This is the auricle.
Okay.
All right, this is the auricle right here. This guy's got good auricles. Okay, so this is the auricle right there. This is the auricle right there. All right, and then deep to that, the chamber itself is going to be the atrium. Okay, so these are the auricles, the flaps on the top. All right, I think we pretty much, okay, base and apex, that's all I got to do. So the base is the big wide part. All right, this is where all your great vessels enter and leave the heart. Okay, the apex is the point. Okay, so normally when we talk about a base and an apex, it's like this, like a mountain, okay? But in the heart, okay, the apex is pointing down and the base is up at the top, okay, because it's the wide part. All right, that's pretty much it. We got them all.